Let's go ahead and begin with the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. Welcome to the Shawnee County Board of County Commissioners. Today is February the 11th, 2021. My name is Kevin Cook. I serve as the chair and also represent District 2. Joining me today is Commissioner Bill Repron, representing District 1. Good morning.
Good morning.
And Commissioner Aaron Mays, representing District 3. Good morning.
Good morning.
Madam Clerk, our first item.
Our first item is item 4, new business. A, County Clerk, number 1, consider all voucher payments.
Commissioners, today we have a voucher totaling $1,323,441.87. Highlights of that are under the sheriff's item, one for Armscore Cartridge Incorporated for $27,900. That's for ammunition. And then another for Axon Enterprise Incorporated totaling $13,180, and that's for the annual evidence.com license and maintenance. I don't have any questions about the voucher report. I would move for approval.
Second.
Motion for approval by Commissioner Mays, second by Commissioner Rippon. All in favor say aye. All opposed? Show that it passes 3-0. Our next item.
Item A2, consider correction orders.
I'll move for approval.
Second.
Motion for approval by Commissioner Cook, second by Commissioner Rippon. All in favor say aye. All opposed? Show that it passes 3-0. Our next item.
Item B, Health Department, number 1, consider authorization and execution of contract C64-2021 Memorandum of Understanding with KTWU for 2 30-second public service announcements on COVID-19 vaccine trust amount, people of color at a cost not to exceed $3,000 utilizing COVID-19 grant funds.
Good morning, Commissioners. I'm Edith Gaines, the Finance Officer with the Shawnee County Health Department. And yes, this morning I am here to talk to you about a couple of public service announcements, or PSAs for short, called Take Your Shot. This is a project of the Health Department's Racial Equity Impact Analysis Group. And the purpose of the PSAs are to build trust among communities of color to encourage them to get their COVID-19 vaccinations. As with many other health indicators, people of color are disproportionately affected by COVID-19 as well. And so this agreement with KTWU is to produce 2 30-second PSAs, one in English and one in Spanish. The PSAs will be broadcast by KTWU, and they will also provide us the PSAs in different electronic formats so that they can be shared electronically and also across social media. These PSAs, the PSAs will be covered by grant funding, and the agreement is not to exceed $3,000. So that concludes my presentation, and I'd be happy to answer any questions you have.
Just a couple of questions, and this is more for a clarification to begin with. The project is covered by grant funds, correct?
Yes, sir, it is.
And so this is not coming directly from the Shawnee County budget?
No, it's not.
And then the money is for the creation of the public service announcement?
Yes, for the taping of the actual 30-second broadcast.
How many times will it be aired?
That I am unsure about, but I do know that it will be aired throughout the month of February for Black History Month.
Okay. And I just think if we're going to spend $2,600 on the creation, we would want to know how often it's going to be aired. Is it going to be aired just for a set period of time? And that's not contained within the document. And just maybe kind of following back around at a later commissioner meeting with how many times it would be aired. And
yes,
then,
I can do that.
Did we reach out to any of the other health departments that we would have in the Northeast Kansas region? KTWU covers a really large area.
Yes, they do.
And I didn't know if we had reached out to any of the other health departments to see if they might be interested in also participating, since this is going to affect more than just Shawnee County.
We did not reach out to any other health departments. However, we have reached out to several other community organizations, as well as there will be medical personnel that are actually acting in the PSAs.
I find that a little bit troubling, given that the virus is not one that knows boundaries, nor the response one that knows boundaries. We have vaccines that are occurring throughout the country and throughout the state and on each county. And so I think that we need to really work hard to break out of our silos of thinking about just us as one small area and form more partnerships where we can.
Yes. Well, and actually, I am working with KDHE. A member of their staff is a part of the Racial Equity Impact Analysis Group. So I am working with KDHE to have it shared at the state level, as well as I'm working with the Kansas Public Health Collaborative. So it would also be shared on their website. So it will be broadcast statewide once we get our copies of the PSAs.
Very good. And again, KTWU does cover a very large area, so the impact from this is going to be more than just Shawnee County.
Yes, sir.
Other questions? Is there a motion?
I'll move to approve.
I'll second.
Motion for approval by Commissioner Mays, second by Commissioner Rippon. All in favor say aye. All opposed, reflect that it passes 3-0. Thank you.
Thank you, Commissioners.
Our next item.
Item C, Public Works. Number 1, consider approval of request to exchange Shawnee County's allotment of 2021 federal fiscal year funds, $803,982.52, for state funds at the rate of 90 cents in state transportation dollars for every $1 of federal funds, and to sign the attached request form.
Good morning, Commissioners. Kurt Niehaus, Director of Public Works. I really can't say it any better than the county clerk did. I'm here before you asking you to approve Public Works' request to exchange approximately $800,000 in 2021 federal funds for approximately $725,000 in state funds. These funds we will use for various projects, various portions of projects. And with that, I look forward to your questions. I guess the bad news is our allotment went down again this year. It has gone down for the last 4 or 5 years. The good news is that it hasn't gone down as much, approximately $8,000 from last year. With that, again, I take your questions.
Any questions for Kurt?
None.
I'll move for approval.
Second.
Show motion for approval by Commissioner Cook, second by Commissioner Mays. All in favor say aye. All opposed, and reflect that it passes 3-0. Thank you, Kurt. Our next item.
Item D, Court Administration. Number 1, consider authorization and execution of contract C65-2021 with DocuSign, Inc. for e-signature Business Pro Edition software subscription to allow the court and its users to electronically sign documents and prepare documents for signature outside the court's own e-filing system at a yearly cost of $4,931, utilizing departmental budget.
Good morning, Commissioners. Stephanie Teal. I'm stepping in for Lee Don Welch today. Before you, we have the contract to move forward with DocuSign, excuse me. We found that this was the best option for our court services officers and executive management team. We looked at 2 other options for similar type of solution, and DocuSign was the least expensive and the most robust. We found that DocuSign licenses are by usage, whereas the others were by user, and were 2, if not 3 times more expensive. Does anybody have any questions?
Any question for the courts regarding this item?
None.
Is there a motion?
I'll move to approve.
In unison.
Second.
Show Commissioner Rippon makes the motion, Commissioner Mays seconds. All in favor say aye. All opposed? Reflect that it passes 3-0. Thank you. Our next item.
Item E, Department of Corrections. Number 1, consider approval of request to post and fill a vacant custodian position at a salary including benefits of $39,694.56.
Good morning, Commissioners. Brian Cole, Shawnee County Department of Corrections. Due to a resignation of one of our existing custodial staff, we're asking to post and fill this position within the Department of Corrections. I have met with Human Resource Director Angela Lewis regarding this. This is an existing budgeted position. This is not a new position, and it takes overtime to cover the existing sanitary and hygiene needs of the facility, which are ongoing 24 hours a day, and so we do need to get this position posted and filled as soon as we can. We do have money in the budget for this, and I'll stand for any questions you may have.
Any questions for the Director?
I'll move for approval.
I'll second.
Show motion for approval by Commissioner Rippon, second by Commissioner Mays. All in favor, say aye. All opposed? Reflect that it passes 3-0. Thank you, Brian.
Thank you.
Our next item.
Item F, Elections. Number 1, consider approval of request to post and fill the Election Manager Voter Services position at a salary including benefits of $63,631.04, and fill any current positions that may subsequently become vacant as a result of filling this one.
Good morning, Commissioners. Andrew Howell, Shawnee County Election Commissioner. We have before you a position in the office that's been actually vacant for several months. We do need to get it filled. It's actually a critical position in the office. It relates to making sure that we have someone in charge of everybody that comes in to vote in the office, as well as taking care of registrations and basically all of the voter services that don't relate directly to election machines and all of the election kind of day setup. So, pretty key position. We need to get that filled. And then, of course, if there's other positions that become vacant as a result of filling that, we're asking permission to fill that as well. So, be happy to stand for any questions you may have.
Andrew, just if you could, for the public and maybe those watching, people would often think that the elections office, outside of November and August, when you have a general or a primary election, you guys just sit back, drink coffee, eat donuts, and have your feet on the desk. What happens when it's not a general or a primary?
Well, we have filings for office going on as we speak for city and school elections this year. We have a primary coming up in August, and we have the general election in November. So there's always those two elections. Additionally, there's always the possibility of a special election. I like to say that basically we go from working 10 to 12-hour days during that 3 months before an election to go into working 8 hours a day and trying to catch up on all the things that we really couldn't effectively do during hosting of all the voting in the office, catching up on all of the registration cards. Basically, there's a lot of record keeping that we really have to maintain, and it's a daily process because unfortunately people do die and those records need to be changed every day. We do get records from the DMV every day. We do get records from the Department of Health and Environment every day about all of those kinds of things. So there's a lot of just ongoing maintenance work of voter records. It takes a lot of time and effort. Additionally, the law requires us to keep ballots and ballot records from an even year election for 2 years. So there's a lot of work that goes into kind of finishing up the work from each of those elections and then putting all the records together, getting them on the website. So there's months worth of kind of additional details that need to occur. And you know, for us, for this year at least, we're doing a lot of hiring because we've had, I think, 3 or 4 positions total from either retirements or people that found other work. So we're spending a lot of time actually kind of ramping up the training side of the office. So there's a lot that goes on. I know when I took the job, I figured I'd be busy at least 3 or 4 days out of the year, but I found that it's actually a full-time job, and then part of the year it's actually more than a full-time job.
So outside of those things that you listed, the legislature is considering requiring all high school seniors to pass a civics exam. And I've often wondered why we don't make sure that every high school senior is registered to vote. And so that way you have that registration already underway, and because when you're graduating, that's a prime time to make sure that you're active. What things do you do to reach out to young people or groups to get them registered to vote?
Well, the League of Women Voters do a very good job in Shawnee County of reaching out to high schools. They spend a lot of time out there doing that, and so we supply them with kits, with registration cards, those kinds of things to assist them in that. Additionally, we've made a number of calls to high schools and also offered, and some have actually taken us up on hosting an event at the office itself where we go over all the processes, where we give them an opportunity to actually put a paper ballot into a machine and see how it scans. And then we actually let them see the tape that is printed out at the end of that process so they can verify that their vote was counted, it was counted correctly, and just kind of get their hands on filling out ovals, handling paper, putting it in the machine. So I like doing that. I think it's smart. I think it actually encourages civic participation when we let high school kids actually get their hands on a ballot and understand early on how that works. So that's one of the things that we also do. I know there's also, I believe we've got a high school or two that actually does their own elections, and so on occasion we will give them ballot boxes, ballots, things like that to give them, and those are not official ballots, of course, but we try to be helpful in that education process as well.
It just seems to me that more things that we can do to keep young people engaged early on, it's crucial to continuation of our democracy.
I'm actually finding a lot of interest in that. I actually had an email recently from a student asking me to do a Zoom meeting with them talking about registration, why it's important. So I'm planning on doing a Zoom meeting with a group here pretty quick as well.
Any other questions for Andrew? I'll move for approval.
Second.
Show motion for approval by Commissioner Cook, second by Commissioner Mays. All in favor say aye. All opposed? Reflect that it passes 3-0. Thank you, Andrew.
Thanks.
Our next item.
Item G, Parks and Recreation. Number 1, consider approval of request to advertise and fill a parks supervisor position at a salary including benefits of $60,078.20 with funding from the departmental budget, and to fill any position which becomes vacant from filling this position.
Good morning, Commissioners. Jeremy Myers, Parks and Recreation. I didn't realize I'd be the third person in a row to be having a position open, so kudos to HR and Angela Lewis for filling these positions. We do have a recent retirement coming up that Lyle Balsh, our park supervisor, is retiring at the end of the month, and I'd like to publicly thank him for his 33-plus years of service to Parks and Recreation. He has probably had his hands and feet and all the equipment he has used in many of our parks throughout our system, and I just want to thank him for his public service for 33 plus years. That's a long time. So, but I would like to open this position and get it filled, hopefully in the next month or two. So if you have any questions, I'd be glad to answer them.
Any questions for Jeremy?
None. I move for approval.
I'll second. Show motion for approval by Commissioner Rippon, second by Commissioner Cook. All in favor say aye. All opposed? Reflect that it passes 3-0.
Thank you.
Thank you. Our next item.
Item G2, consider authorization and execution of contract C66-2021 with Atec Recycling, Inc. to provide recycling materials for collection and proper disposal to be expensed from the Departmental Operations budget.
Good morning, Commissioners. John Boyd, Parks and Recreation. We are requesting you approve this contract with Atec. This is actually a contract that was approved for hazardous waste. We're just kind of piggybacking on it. When we go in and relamp a building, we take all the fluorescent tubes and we need a place to put them. And we tried to take them to hazardous waste, but we found that we overloaded his system and he was locked out of being able to accept any more hazardous waste fluorescent tubes. So we just piggyback their contract, and we'd like to open an account and separately get rid of the fluorescent tubes that way. Do you have any answer any questions?
Any questions?
No. I'll move to approve.
I'll second.
Show motion for approval by Commissioner Mays, second by Commissioner Rippon. All in favor say aye. All opposed? Reflect that it passes 3-0. Thank you. Our next item.
Item G3, consider approval of request to award the bid to Midwest Coating Inc. for the roof replacements of the Preston Hale room at the Mead Mansion, $19,932.77. Abbott Community Center, including the gymnasium roof, $29,845. and $2.75 per square foot to be expensed for any deck replacements utilizing the Building Maintenance 3R Fund, and authorization and execution of contract C67-2021 for same.
Morning again, Commissioners. John Boyd, Parks and Recreation. We're requesting approval for the contract to get these roofs replaced. We went out for a competitive bid, and we evaluated them and determined that they were the best ones to go with. Any questions?
Questions?
Do we do all the maintenance at Abbott Center?
I'm sorry,
Do we do all the maintenance at Abbott Center?
all the maintenance.
Yes,
Well-
the Shawnee County, we manage all the maintenance as part of our contract with Boys and Girls Club.
Okay.
Yes, I'm sorry, yes.
All right. That was my only question. Thank you.
Any other questions?
No?
I'll move for approval.
I'll second.
I'll show a motion made by Commissioner Cook, second by Commissioner Rippon. All in favor, say aye. All opposed? Reflect that it passes 3-0.
Thank you.
Our next item.
Item H, Sheriff's Office, number 1, consider receipt of correspondence from Sheriff Hill to send an officer to Tulsa, Oklahoma to attend a forensic crime scene investigation course with expenses paid from the 2021 budgeted funds.
I don't know if we have a representative from the sheriff here or not. I don't see. This is typically just a training seminar, so I'll move for approval.
I'll second.
Show motion for approval by Commissioner Cook, second by Commissioner Rippon. All in favor, say aye. All opposed? Reflect that it passes 3-0. Next item.
Item I, County Councilor, number 1, consider approval of request to reclassify the legal office manager at a salary including benefits of $64,981.69.
Good morning, Commissioners. Jim Krause, Shawnee County Councilor. This is a request to reclassify my legal office manager position in my office. It's a critical position that does payroll, budgeting, oversees our tax foreclosure sale process, also serves as a paralegal for litigation. The incumbent in this position, Tabitha Push, has been there in the position for almost 2 years. This will move it back to the range it was before she was hired in on the position. The second action I'm going to do is in the other support position, change the position description to drop the paralegal requirement for that position to make it more consistent with the applicants that we've been receiving for the position. I've discussed these two actions with Human Resources, Angela Lewis, and I would be happy to answer any questions you might have about these actions.
Any questions regarding?
No.
I'll move for approval.
Second.
Motion for approval by Commissioner Cook, second by Commissioner Mays. All in favor, say aye. All opposed? Reflect that it passes 3-0.
Thank you.
Thank you. Our next item.
Item J, Commission, number 1, review of current health order.
Good morning, Commissioners. Craig Barnes, Shawnee County Health Department. I'm going to kick off our discussion of the health order today. As we had done with the Board of Health when we had the health order 2 weeks ago, we released the scorecard as part of that discussion. So our plan is today as well, prior to the health order discussion, when we'll introduce Dr. Aaron Locke, is to share the scorecard with everybody today and then lead into the health order discussion. So let me pull up the slide here. And this will give us, okay. So as you see on the screen here in front of you, this is the scorecard for this week, which is for the period last week, so January 31st through February 6th. As you'll see here, there was an overall decrease again in the summary index this week by 2 points. This keeps our community in the high index this week for the second straight week. So we did move from 16 to 14 in our overall summary index. Several of the measures, again, this week show encouraging and decreasing trends. Many of these measures seem to mirror what we're seeing across the state and in some instances across the nation and those other states as well. For the fourth straight week, the case incidence itself, which is listed as the top number there, has seen a increase or a decrease for the fourth straight week. This week decreasing 19.3% to that 364 cases in the week. Again, those numbers are the cases that are by date of diagnosis. The number of cases overall still does remain in the uncontrolled, as you see there. We want to get that number down to 175 cases per the reporting period to get ourselves and feel that the outbreak itself is more under control. Percent positivity dropped to 6% on the nose there, as you can see. This is the fourth week that we have seen the percentage of positivity of the tests decrease. So again, showing that encouraging trends and decreasing trends. Hospital occupancy rate, that number has decreased again. It has decreased now for the third straight week, settling in at 86.2%. The average number of hospitalizations per day for COVID-related disease has been 51 over the last 14 days. For example, yesterday we had 39 hospitalizations that were COVID-related in the hospitals that we reported. Pressure, excited to announce here, as you see on the last before the final score here, that the pressure on the public health system capacity has decreased out of the uncontrolled index for the first time in 6 weeks. Here is nice to see it has actually dropped all the way down into the moderate. A couple of different variables that have contributed to that, most notably the ability for the health department now for the second straight week to assign out 100% of the cases that have been reported to the health department. That is a couple of different factors, not only the cases decreasing themselves, but also I wanted to make sure that I give the shout out and the thanks again to the city of Topeka and their AmeriCorps volunteers that they have given to us. We have every week, Monday through Friday, working from 8 to 4, a group of 5 AmeriCorps volunteers that are assisting us in case investigations and calling on those cases. So this is really shored up our capacity to investigate those cases, and then also as a tail end of being able to investigate those, then also to assure the isolation and quarantine moving forward, and then follow up and also start investigating more into the clusters that are here in Shawnee County. So that has really helped to bring that stress level down on the health department as a whole. And so that you can see signified in that score lowering into the 10 in the moderate role. With that, as I mentioned, we were able to assign out 100% of our cases. We have been able to make contact and then investigate 84% of those cases here in our community. So that is extremely good to see. That is hopefully helping us then identify where individuals are contracting this. Hopefully it will, in the turn, also lower that percentage of no known source of infection as well. And this will allow us to target interventions with organizations if they're having a cluster with getting them the appropriate testing supplies, as well as talking about mitigation strategies on site. I want to take the opportunity again, just specifically also to make sure to thank our staff and volunteers. I talked about the AmeriCorps volunteers. Those are not the only volunteers that we have in the health department. We have a multitude of other volunteers working in several capacities, manning our phone lines, helping take in calls for the vaccine appointments, or interest in the interest survey and filling those out, fielding calls about appointments throughout the community. And we also have a multitude of volunteers serving at our vaccine clinics that the health department is putting on. So I wanted to make sure that I give the kudos and the thanks to all our volunteers that are assisting in this endeavor, as well as the health department staff as a whole. There are a lot of staff that are working 10 to 12-hour work days, weekends, and so I want to definitely in public thank all of our staff and volunteers for all of the time and effort that they're putting in. And then the last thing that I typically end any time, whether it's our press briefings or any presentation, is just, again, even though our numbers are improving, I think it's still imperative that we practice and promote those 3 W's. So watching our distance, washing our hands, and wearing our masks. So with that, I will be happy to answer any questions about the scorecard that you have. Otherwise, I will turn the podium over to our health officer to discuss the health order.
Craig, I might note that it's really refreshing that we can review the scorecard during a county commission meeting and talk about our scorecard during a county commission meeting with you, and not have to wait until after a county commission meeting to try and catch up to a scorecard. So thank you for doing that
Yeah.
during the meeting.
Definitely.
As to the creation of the scorecard, can you review with us who is all involved in the creation of this scorecard? Who calculates the numbers? Is it
Yeah.
just you or is it a team?
So it's a team of us here at the health department. We get a lot of engagement from mainly our surveillance branch as part of our incident command structure. We have a partnership and a contract that you all had approved last year with KHI to help us do some looking into the numbers and making sure. As we mentioned at the Board of Health, we're open to suggestions about this and more than willing to discuss potential changes in the future to the scorecard. But at this point in time, this is the scorecard that we're working on, and we have made some changes throughout. But we feel that this is a good representation at this time of where our community sits.
Okay. Questions for Craig?
Yes.
Commissioner Riplon.
A lot of and I'm sure the other commissioners get emails about schools opening. And I know we kind of bowed out of the decision-making for schools, but on the other hand, our scorecard influences what schools do. And I got to looking at what other communities are doing. I looked at Wichita, I looked at Johnson County to see how they're making their decisions. Johnson County, I found they have a lot of information on their website, but no scorecard that I could find whatsoever. Sedgwick County, their schools view two components, and what they look at is case number trends, whether they're decreasing, they're steady, or they're increasing. And they look at the previous 2 weeks, percentage of positive tests, and that's it. That's all they look at. I know in our school system with our card, we look at new cases, which you get double points for that. There's trends in cases from week to week. There's percentage of positive tests, and all these you get points for, of course. And percentage of cases that cannot be contact traced. Hospital occupancy rates. And then public health capacity stress. And I just wonder if we're not scaring people off or scaring our schools from reopening with this point system. Where did this system come from? Is this a CDC?
And actually, before you answer that, Craig, I just want to, because this is a good point, and I was going to make this point later, but at this point, before Craig answers, Jim, can you come to the podium and address the schools? Because we do get emailed a lot and stopped on the street a lot and phone calls a lot. And everybody wants to know why the county commission hasn't opened up the schools. So, Jim, does the Shawnee County Commission have any authority over school districts?
Let me answer that question. Jim Krause, Shawnee County Counselor. No, the resolutions that we have been adopting with our health orders specifically exempts K through 12 public and private schools from the provisions of the order. That followed an Attorney General opinion a few weeks before that basically indicated that schools could exempt themselves from executive orders, and it raised the implication that schools also had the independent legal authority to exempt from county orders. So we made it clear at the time that our school boards would be working with their parents and their families and make the decisions for themselves. And obviously, and we put the language right in the resolution that we encouraged our schools to work with our health department, work with our state partners, but we were not going to mandate how or the manner in which schools would operate or how in the manner they'd operate their extracurricular activities.
And isn't that consistent across the state that every school district is able to operate and that they're not beholden to a county commission?
If you agree with the Attorney General opinion that was issued, I can't, as I stand here today, tell you what each individual county has done in that regard, but I don't think we're an outlier.
Okay. And then the Kansas State High School Athletics Association, KSHA, they regulate their own activities and what rules they have regarding their sports.
Correct.
And we're not part of that.
We're not.
And the MIAA for colleges, they regulate themselves, and we're not part of that.
Correct.
And the NCAA, which, should they come through and play in Topeka, we're not part of that either.
Correct.
Okay. And then finally, the school districts in Shawnee County, are they beholden to this scorecard? Are they required to use our scorecard for their regulations?
They are not required to use it.
So if they choose to, it's by their own choice.
Correct.
And if they choose to follow our scorecard or look at our scorecard, it's because of their internal policies, not because of anything that we have directed them to do.
We have not mandated that any schools follow our scorecard.
So if people have concerns about their school districts, they should be going to the school boards and not us.
Yes.
Okay. Just want to make sure that's clear.
Okay. Yeah, I'm just saying that our scorecard does have an influence on the schools. I'm not saying we don't have any influence on them, but our scorecard does. And I think the scorecard has influence on a number of other items too, like our economic recovery and something like that. And I'm not endorsing what Wichita does with their schools. It's just information. On our scorecard, I always hated the word uncontrolled. I haven't seen anybody else using that on their whatever they have that they're presenting to the public. I think when we use that word uncontrolled, it keeps our kids out of school. It keeps businesses from recovering. It keeps companies from coming to Topeka.
But I interrupted you, Commissioner, and I'm interrupting you again, but the question you had for Craig Barnes is, are we scaring people by the scorecard? And so I think I've given Craig enough time to think of his answer by now.
Indeed you have, and Jim, thanks for giving me the extra time too, coming up here and talking. So the intention of the scorecard obviously is not to scare anybody. The intention of the scorecard, as we've developed it, is to give, in our opinion, an adequate representation of the virus here in our community. This is the scorecard as listed is a community transmission and severity scorecard. So that's what its intention is to do, is to tell that story. And the other side of that question as well is the schools themselves also have a state gating criteria that they're able to utilize. That's for the state, and it breaks down by the community that KDHE puts out. It's on their dashboard and their website. So there are multiple avenues. As we've mentioned many times to this board, is we do meet weekly with the school districts, and so we have a standard set meeting. So we are able to talk through these figures as well as other things within their districts to assist the school districts with questions that they may have. So we do meet with the school districts weekly on that. And then the figures here are not numbers that we just came up with. The figures here come from the CDC or KDHE as well. And so it's not that we created these numbers to create a threshold. These are numbers that we're getting from the experts in their field to help us articulate in some way that hopefully the public can understand what the transmission and severity looks like here in our community around COVID-19.
And I've harped on this before, that I think when schools, they look at our scorecard. I also think they ought to have the information on recovery rates, especially for kids 18 through 5.
Mm-hmm. And so as we've mentioned with recovery rates, that's a very hard number to tabulate. Recovery rates, because we still, as a novel coronavirus, we do not know how to appropriately list the recovery rate of an individual. This is the same thing that we got and talked about with our dashboard, is we removed the recovery notation on the dashboard and set it to individuals who have been released from isolation. That is for twofold reasons. And one, again, reinfections. We are now knowing that there are reinfections occurring, so an individual cannot be considered completely recovered. And the long-term chronic effects that are being investigated and researched around the coronavirus that can affect an individual much longer past just the immediate period after their 14-day period.
Craig, you can have effects of the measles or the mumps or anything, but people that recover are generally people who are not sick. We don't have any trouble, it seems like, telling how many deaths we've had from COVID, even though maybe up to 90% of them are comorbidity, and we don't present that number either. But I think the recovery rate, or even if we called it hospitalization rate, that we could put, that's a hard number. And if we put what the chances of a school-age kid being hospitalized would be good information. If I was a school board member or a parent of kids, that's what I would want to know. Like if Commissioner Cook went to his doctor and the doctor came in and says, I've got some bad news, you've got cancer. What's the first question he is going to ask? How many people in the hospital have this? What are the trends? No, he's going to want to know, what's my chances of recovery? What's my chances? And I think that's critical information that we need to have out there for the public to see. And it helps parents, it'll help school board members make decisions on whether to open schools or to send their kids to school. I just think that's critical.
Commissioner Rippon, I know that you've been asking for recovery rates since the beginning, and you continue to ask for recovery rates, and I appreciate your fortitude in continuing to ask for that same information. But I think that we have to look at, again, and this might be an issue for our health officer to maybe kind of also address, and the scorecard, is the scorecard an accurate reflection of the community? Are there different ways to calculate the scorecard, and is there a different way to reflect how the virus is impacting Shawnee County? And I think those are valid questions that need to be continued to present, always adjusted as we know more about the virus. In the past weeks, I recognize there have been some school districts that have been impacted by not an outbreak among the children, but an outbreak or quarantine among their staff. And the staff outbreak can cause a school to not be able to function.
I think they've been looking at vaccinating teachers and staff, moving them up on the food chain for shots.
And I think that we're going to be talking about vaccinations here in a little bit and how that's progressing.
And too, I think that's critical. I think we need to get vaccinations to teachers and staff so we can get the kids back in school, because that, to me, is the biggest critical issue right now, is getting kids back to school.
So when Dr. Locke comes up later, we might want to hold that question for the doctor. Sure. As to our scorecard and any adjustments that we might want to make to the scorecard.
Okay.
I'll just add as well to that, and I said this already, but we are more than willing to have a discussion about how to, again, also, the goal of the health department is to put out information that is useful for you as our Board of County Commissioners who serve as our Board of Health, but also for the public, and make it so that it's understandable. So as I've mentioned throughout this, we are very open to have open lines of communication. We'd be more than willing to have these discussions with you. And in the public, we're always open to receiving feedback from our public. The public feedback that we had earlier on in this pandemic is what helped us lead to our current iteration of the dashboard. So I want to make sure that I give my thanks as well to the public for telling us what it is that they wanted to see on our dashboard that we update daily, because that's what helped us create and add the numbers and have things listed on the dashboard that are there. So any other questions that I can answer for you today, Commissioner Mace?
Nope.
Okay.
Thank you.
Well, with that, I'm just going to move to the next slide, which is just a placeholder slide, but I'll introduce Dr. Erin Locke, our new health officer, here to talk about her first health order. So.
All right, doctor, it's been 2 weeks. You haven't run away yet.
I'm still here. Can you hear me well with the mask on?
Yeah.
Okay. Well, as you can see by the scorecard we were just discussing, timing is everything for when you start as a health officer. It's very nice to be joining the team when trends are in the right direction. So, okay, so to discuss the changes to the health order, I'd like to start by saying this had unanimous approval from the Technical Advisory Committee when we met on Tuesday morning. They had no concerns or recommendations for changes. And we'll start with sort of the mass gathering section. So what will remain are the 10 people in a group when you cannot maintain 6 feet distance. And so that will stay the same. But we are expanding the limit from 100 to 300 for events and other gatherings or organizations. So that 300 or 50%, that will remain, whichever is fewer. And we do expect that individuals maintain the social distancing and mask guidelines even with that change. If there is an event that is expected to have more than 300 or to expand past our guideline, we are welcoming plans to be submitted to the health department at least 2 weeks before the event so that we can review it, provide any suggestions, and make it a safe event. So that is an additional change that I believe has not been available since the numbers were low last summer, I think. As far as restaurants and bars, we're now recommending that they stay open until midnight. We recommend that we continue to seat 8 people together at a table. We're now also recommending that the bars and counters be open for seating services with guidelines, the social distancing and mask guidelines in place as well. And finally, we're bringing karaoke back. So that has been banned, and we are including that in the live music section as long as the 10-foot distance between the singer and the crowd is maintained and extra cleaning of the microphone. So that's, I think, the general summary of the changes in the health order.
Doctor, on Monday, Ms. Donahue with WWW asked me, you just got out of the uncontrolled and now you're back to the Great Overland Station. Do you think you've jumped the gun and reacted too quickly? So I'll ask her question to you. Do you think that Shawnee County is jumping the gun and modifying their orders too quickly with our changes to where we're at?
Thank you for that question.
I figure she would ask you, so I'm going to jump ahead.
The scorecard is really there to help us to make decisions, and I know that you had that plan in place, that once you were in the high and out of what we call the uncontrolled, this is what you would do, and then if it gets down to another level, you'll do something different. And so I think you're showing the example of how we use where we are to make decisions, and I know that if we were to go back into red, you would reflect and respond to that. So, and we're all wearing masks, and we're social distancing, and we're doing all of the mitigation recommendations that we've received from all levels of our government.
Thank you. Questions for Dr. Locke? Commissioner Mays?
No questions. I'm excited to see the progress. I want to thank you for your willingness to, reevaluate everything, and technical advisory team for their work in reviewing it. Also want to thank our community for their hard work in helping to stop the spread of the virus.
I'm encouraged by the changes. I like it, so good.
Okay. All
Thank
right.
you.
Do we need a motion to approve the resolution?
Are you making the
I'll
motion?
make that
Do we
motion.
have a resolution yet?
We do.
Okay.
So there's a motion to adopt the resolution from the health officer by Commissioner Mays. Is there a second?
Second.
Second by Commissioner Rippon. All in favor, say aye. All opposed? Reflect that it passes 3-0, that the Shawnee County Board of County Commissioners has adopted the health officer's current health order, and that will take effect then beginning on February the 12th. And Doctor, how long did we set your health order for?
I believe 1 month.
Okay, so we would review that then in 1 month unless circumstances change, and then you would always be able to reapproach the county commission.
That's exactly right.
Okay. And that, again, reflects that it passes 3-0. Doctor, before we let you go, on the health scorecard, again, we get asked a lot of questions about the scorecard and about the dashboard, and I know that you've only been with us for 2 weeks, but what are some of the things that you might be looking at with the dashboard and with the scorecard, and kind of your thoughts overall.
Yes, I understand that there has been quite a lot of scrutiny of the scorecard, and so my first step is to go back to the data, basically. For each mitigation measure, I understand that there were sources of information that were utilized to set those numbers, and so that's my first step, is find those sources, make sure there's no new information, new updates as we've learned more about the virus over the last several months, and make sure that they still make sense for us. But I do intend to find as much data and science behind the decisions as possible, understanding that sometimes we just don't have it for certain measures.
Thank you.
Dr. Locke, one of the things that I've talked about before, and you and I have discussed this as well, is that at some point I'd like to see the number of vaccinations given included either in the scorecard or on the dashboard, and I don't know if we need to separate it out by first dose versus second dose or whatever, but completed vaccinations perhaps might be a good way to do it. But I think that would be an interesting metric to tabulate and post publicly so people could see.
Yes, there's a lot of excitement around the vaccines, and also a lot of confusion too. And so we do plan to have information available, and I believe by the end of the week. I do not know if we were considering the number of vaccines, but we will definitely discuss that. If you'd like to know the total administered so far, I do have that number. It's 31,130. But that does include first and second doses. And so that's how many have been administered so far through our system. That does not include long-term care and other vaccines that were distributed through the federal pathway.
And so, and I don't want to put you on the spot with trying to do math in your head, but how would that, if you extrapolated that out as a number of individuals and kind of as a percentage of our population, or what are we, 10% now, or?
Oh, you know what? I don't know that answer, and I don't know. Do we know that answer? Yeah.
Greg Barnes, Health Department. Really just coming up here to say that we don't know that answer, and for the most part at this point. But what we're doing, so as Dr. Locke mentioned, we have our Shawnee County Vaccine Collaborative, which is a partnership between Stormont Vale Health, University of Kansas Health System, St. Francis Campus, the Health Department, Grace Med, and then the VA. And so the numbers that she shared include, like she said, the first and second doses. We're trying to extrapolate that down and so that we can get them separated, so we have a little bit better idea of the individuals. The difficulty, if you will, that we're having at this point in time to be able to give an adequate or an exact representation of the total number of doses that are administered in our community is that we're having a very hard time making contact with the pharmacies that did the long-term care facilities, so CVS and Walgreens. So those numbers are coming through the federal allotment. Those are separate from the state allotment that we tap into and our partners do. So it's a little bit easier for us to get those numbers. And the VA, I want to give the kudos to them. They have been a great partner with us through this collaborative and sharing some of those numbers. So we're able to get some of those numbers, and that's where we can give you that 31,000. But we know we're missing a portion. But I will say, too, that we have been able to, this week, to start conversations very in earnest with the local pharmacies, Walmart and Dillon's, and Doug's Pharmacy in Rossville, that will be getting initial allotments to get a better idea of how much doses will be coming into our community. So our vaccine collaborative and our team is working very diligently to try to attack every avenue we can to get those numbers so we can get an adequate representation, because we know that's wanted. But at this point in time, we can just share a portion of that. And I know that's frustrating, but we're trying to get those numbers. And so we would definitely appreciate assistance if we can try to track that down. The other thing that doesn't include is the numbers that if KDHE stands up for their state pods, if they are doing residents of Shawnee County with any KDHE vaccination pods, we do not have those numbers either. So I just want to, in full transparency, that's what our numbers are and where we're at, and we're working to try to separate between first and second doses at this time.
Okay.
I would like to see hospitalization rates by age group on the scorecard.
Sorry,
Whoops.
just ended the slideshow.
Doctor, I know that we're going to be talking about vaccines in just a little bit, and outside of the schools reopening, vaccines seem to be the next biggest thing that we're being contacted about. Either I'm trying to get vaccinated, or I'm trying to get my parents or grandparents vaccinated. But at the same time, we keep getting emails or contacts about there being leftover doses, or that not all the doses are being administered, or some doses might need to be disposed of because they weren't administered. Is there anything, are we winding up with some wastage and not being able to get the doses out because of at the end of the vials?
My understanding is that we do not have any wastage.
Okay.
So where I believe this comes from is that with the Pfizer vaccine, it comes in a bottle and they say 5 doses, but you can actually get 6 and sometimes 7 doses out of it, but it's not something you can necessarily count on all the time. And so to schedule someone and then not have that dose is, we wouldn't want to do that, basically. So my understanding is that as they get scheduled for what we know we have, and then if we're able to pull those extra doses out, we try to get people in. And then, of course, just like with any medical thing, you schedule someone and then there's no shows or things come up, and so we try to fill those in as well. But that's my understanding, that we have actually had very little to none wastage with our vaccines.
Okay.
Oh, yes, absolutely.
Sorry, I'm stealing our health officer's thunder today. Just an additional piece to that. So, for example, with the health department, I can tell you right now we have had 7 wasted doses total through all doses that we've administered. Those 7 are specifically due to faulty syringes. And so those are not that there were just leftover vials or doses left. The way that we operate within, and I know that the health systems do as well, if they pull on a vial to complete their vaccinations, they have someone who they've already scheduled, and like as Dr. Locke mentioned, if someone does no shows or something like that, if we're using the Pfizer vial, which has, as Dr. Locke, the 5 doses in it, maybe a 6th, sometimes even a 7th, dependent on it, then if they tap into one vial, and it's the last person of the day, now they have 4, if not 5 doses left in the vial that they have to use. They can't just put it back in the freezer and save it for the next day. So that's where those end-of-day wait lists and things of that sort, to make sure that you call the individuals who are eligible to bring those folks in to receive a dose. We do the same thing. Moderna instead has 10 doses in it. And so when you do that, if, again, you tap into a vial and you do 2 doses out, now you have to find 8 additional individuals to make sure that you don't have any wastes. And I can tell you, from our health department operations, we have been very diligent in that, and like I said, no wasted doses at all due to vials being open and then not being able to utilize those. The only waste we have had as a health department operation has been for those 7 faulty syringes. So.
Hey, Craig, I know that we're going to be talking about vaccines here.
We're talking about vaccines now, right?
So we have the Shawnee County Health Department that's giving out vaccines.
Mm-hmm.
Stormont Vale, KU Ardent, St. Francis. We have some that are being administered through the feds to nursing homes, nursing facilities, and then the VA. Mm-hmm. So those are at least 5 different entities that are distributing vaccines right now.
Yeah.
And so if a person is wanting to get the vaccine, who do they call? Do they contact the VA? Do they contact their hospital? Do they contact Shawnee County? Mm-hmm. What list should they be getting on?
Yeah, that's a great question. And really what we've said is we encourage the individuals here in Shawnee County to try to receive a vaccine through any avenue that they can. If that's being on the Shawnee County Health Department's list, if that's being communicated through the University of Kansas Health Systems, For example, so for the VA, they're obviously working on our veterans here in our community. So if you are a veteran, we encourage those individuals and have been to reach out to the VA. They have their own risk stratification table that they're working through, and they're making contact directly with those individuals. Stormont is working specifically through their list for anybody who has received care from the Stormont network in the last 3 years. So if you are in their system, had received any type of care in the last 3 years, those are individuals who are uninsured, maybe not have a primary care provider even within their network. But if you have received care, they're working through those, again, on a risk stratification level. Right now, I believe they're at 71 years of age and older. And then KU St. Francis, they have a survey that you can do, and they work on a first come, first serve through their survey, 65 and older. And then we have our interest survey, and I know this is getting confusing. So as Dr. Locke had mentioned, our goal as the health department too is to create almost a one-stop shop, if you will. So we're creating a vaccine webpage with the assistance of our IT department that will be launched hopefully by the end of this week, that will have all of that information in one place so that people can come to it. The issue is we've got allocations of vaccine coming into our community that are from the state level, that we have a little bit more glimpse of being able to see where they're going and who's got them and how to do that. And then there's the vaccines that are coming through that next level, which is the federal allocation that we are not really aware of, how many doses are coming in, where they're going, and things of that sort, unless we are able to make communications with those recipients. And so that we have been able to make some contact with it, but we don't have a full idea yet. That goes back to trying to also identify the number of doses being administered. So.
But with all of these providers and all of their surveys and signups, doesn't that create confusion that Commissioner Rippon could sign up with KU, St. Francis,
right,
and Stormont, and Shawnee County, and the VA, and so you don't know really what list he's on, and he might get one from the VA, but tie up space on the other three.
But whether or not somebody is on one list or another, in the end, ultimately doesn't matter, because if we contact you as the health department, as we go through our prioritization and survey, and you've received the vaccine, we move to the next person. And so whether or not you have gotten it between one avenue, we get routine emails through our COVID vaccine that says, thank you, you can take me off your list because I've gotten it through this avenue. So again, to us, that shouldn't matter, because as we move through, if you've received it, you got the phone call, then you've been taken care of by a specific organization. That's only going to get, whether it's frustrated or not, is going to get more confusing as more individuals in our community begin vaccinating. As we talk about local pharmacies, we're doing a really good job in our community of trying to make this a coordinated approach as much as possible, but the moment that spreads out into more individual pharmacies, individual providers, and the like, makes that tracking mechanism all that much more difficult.
And I guess my question really was more, is there a central database that says these are all of the citizens, and this is a notation of everyone who has received the vaccine, so that there is a notation, a central database of who's gotten it?
There's not to that specific terms, there's not a central one location where every single person, other than the state's WebIZ reporting system, that tracks all of the doses that are administered within Shawnee County.
Because I think to get to Commissioner May's question, we'll never know. With all of these different partners, we'll never know how many people are actually vaccinated.
Probably not, but I think we could maybe come up with an estimate.
Correct, and I think that's what I was trying to allude to, is we can get to as a comfortable number with us as approximation, if you will, or an estimate of where we're at, until we can get some more engagement at the level with those entities that are receiving those direct federal allocations, which is promising this week. I will report that. So.
Okay.
Yeah, I'm not asking for a specific exact number, because obviously it changes. They could tell me an exact number right now, and in the next half hour, probably 20 people are at the Stormont Vale Event Center getting vaccinated, and it changes immediately. So, if we could just get kind of a ballpark figure to just have a sense of where we're at. So, and I know, we know how many people are in nursing homes in Shawnee County. So, that's, the kind of thing we just have to assume that a good number of them have been vaccinated.
And we will need to have that information to some extent as we move through phases, so that we know we've vaccinated this group, and now we can move on to another group. So I agree, we want that data too, absolutely.
And Doctor, this may be a question more for you or for Dusty Nichols, but Commissioner Rippon asked earlier about vaccines for schools and school teachers. Are we looking at making a teacher or the staff priorities, or how are we going about that?
We are. So if we actually start kind of big in the United States, Kansas is one of maybe about half the states who have prioritized K through 12 staff into as high as phase 2, and then we as a county are able to sub-prioritize those groups that are in phase 2. We've moved K through 12 up to the top half, so they are in 2A, and we do plan to start vaccinating K through 12 staff next week, with the goal to be that every staff member has had their first dose before spring break. So we have, so to answer your question, we have really highly prioritized K through 12 staff, understanding the pressures the schools are under, and that we all have the goal of having children back in school. I would like to share, though, because 65 and older are the group that's most at risk when they actually get infected, and so that group we will not stop vaccinating that group. As Craig said, we have the federal allocation that is entering our county starting this week and will ramp up next week. To our understanding, they will be focusing on 65 plus, and then Grace Med and ourselves at the health department will also be focusing on 65 plus. But the rest and the majority really of the vaccine will be going to K through 12.
All right. Questions?
When people when they go onto our website, what do they see when they're wanting to see about vaccinations? Is it a good, clear path for them, or is there anything confusing? Or,
I think, yeah, sure, go ahead.
I just want to make sure when people get on there, it's a
that's a great
simple,
question, and that's when I alluded to what we're trying to create is a more streamlined approach to separating the vaccine information from the rest of the COVID information so that it's all on one page and trying to pull it all together. So what we have now is if you were to open up the health department webpage, you would see banners at the top. And so there's one, say, for example, for testing, there's a prevention one, and there's one for the vaccine interest survey. So it's really easy to see. And so what we're going to be doing now that we're going to be pulling all the vaccine information into one, again, is one of that banner will be vaccine, and it'll have all of our FAQs, documentation, links back to the state's dashboards and things of that sort, and then the information that we're doing here, kind of as Dr. Locke mentioned, was our prioritizations that we've done here in our community, and then additional links. And so it'll be a banner right on the homepage for the health department. It'll also be on our sidebar, and then it'll be a link to the general. So there'll be 3 different places that easily find out how to get directly to that vaccine page.
Thank you.
Questions about Dusty?
As we're talking about vaccinations and signing up on the list, I just want to catch a couple things that might have slipped through the gaps. If you don't have a computer, you can call 251-4949 and get assistance. Some of the churches have also set up some phone banks that you can go through. We work with those groups on every Wednesday. We have a meeting with them. They're really strong in community support. So you could possibly go through your church to help get signed up on these lists if you don't have a computer. The other thing I just want to mention, as the doomsday guy, that's me, there's always bad actors. If you are getting emails or phone calls or anything else to say you can get your vaccination here and they're reaching out, be suspicious. If it's too good to be true, it probably is. So verify and check on it. So we'd hate to see anybody get caught up in some kind of fraudulent hurtful vaccination scam. So please be wary of that. Know what you signed up for so you know where to expect the phone call to come from. I think that's it. I think I caught the stuff I needed to. So.
Okay. Questions for Dusty?
Yeah.
Thank you. So, Doctor, thank you for updating us and your work and sticking with us for 2 weeks, and so we'll see you in another week or two.
That's right. It really has been a pleasure seeing the behind-the-scenes work of everybody working so hard and the collaboration with all the different partners in the county. It's hard work, I'm not going to lie, and I've lost some sleep, but I think it's really worth it, and I appreciate the opportunity.
Thank you.
Thank you.
Our next item.
Item 5, Administrative Communications.
This is an opportunity for any department head, member of the public, to comment on any item.
Good morning, Commissioners. Tim Laurent, Director, Shawnee County Parks and Recreation. This morning, I just wanted to take a minute to introduce a new member of our Parks and Recreation team. Lexi Ray is with us here today. Lexi is the new program event manager for this facility for the Great Overland Station. Lexi holds a Master's of Arts and Museum Studies, specializing in education from the University of Kansas. Lexi will be responsible for programming and scheduling special events, exhibits, programs, in addition to overseeing the operations, daily operations of this facility. So I think Lexi would like to maybe say a few words.
Good morning, everyone. I just wanted to thank you for giving me the opportunity to be here and to work with the awesome team in Parks and Rec, and I'm looking forward to making Great Overland Station a place for everyone to enjoy.
Well, thank you for joining the team, and we look forward to you and what ideas you might have for the building and the facility and how we can move it forward.
Definitely.
Thank you, and welcome aboard.
Welcome aboard, Lexi.
Is this the right time where I can?
Yep, this is the public comment. Yep.
Thank you. I want to thank the commission for letting me have time to speak, and I'm really glad that Dr.
We'll need you to say your name. For
Oh,
the
I'm sorry,
record.
my name is Joe Hopek. I'll tell you a little bit more about myself in just a moment. I'm also glad that Dr. Locke is with us and will hear my comments regarding the scorecard. It's something I'm very interested in. At any rate, just to give you a little bit of context, I'm a grandfather of 13 grandchildren, and my wife and I have been profoundly affected by the closing of the schools, having been involved in remotely teaching up to 7 of our grandchildren at one time. So we're familiar with the burdens that placed. But I also want to tell you that I am retired from the Stormont Vail system. I retired 4 years ago. I was recruited by Stormont Vail in 1975 to assist in the start of a cardiac surgery program. My expertise and my training was in the technology surrounding cardiac surgery, heart-lung machines, artificial hearts, assist devices, etc. I did that for 23 years for the Stormont Vail system. And at that point in 1998, I was promoted to the administrative director for the entire cardiovascular program for the Stormont Vail system. And I functioned in that capacity for 18 years. Part and parcel of my responsibilities, I was responsible for construction of the Heart Center in Topeka. And I was tasked with and was responsible for creating a structure to collect clinical data for various procedures, disease entities, such as cardiac surgery, balloon angioplasty, cardiac catheterization, acute myocardial infarctions, heart attacks, and I was responsible for that. I worked with the Society of Thoracic Surgeons. I worked with the American College of Cardiology, as well as working with the federal government, because cardiovascular data became so robust that the federal government started looking at impacting our reimbursement based on our outcomes. I say that all just to let you know, looking at your scorecard is not my first rodeo at looking at data. And I bring those eyes to me. And anything I have to say is not critical of any of the commissioners, and certainly not critical of Dr. Locke, because she's new. But I looked at the scorecard through my very experienced eyes at looking at data, and there's quite a bit to say about it, and I was quite astounded when I looked at it and dug into it. So let me begin by saying, I saw you had a copy of the scorecard up there. Is it possible to pull that up? Or if not,
Craig,
yeah, go ahead. Okay. Can that be scrolled down? Can that be scrolled down to the rest of it, if I want to?
No, that is a single slide with just the indicators at the beginning.
Okay. In that case, I'd like to give the commissioners a copy of the entire scorecard because it's important. The scorecard is basically, if you look at, first of all, your scorecard is important. I appreciate your comments that the schools don't have to respond to you. They're not accountable to you or legally responsible to follow your edicts. But you are the leaders of the community. What you say matters. And there's a principle, as the head goes, so goes the body. So this thing is important. The school shutdowns, everybody knows that this is impacting kids. It's negative. There are a lot of negative things about it. Kids at risk don't get to contact with the most people of best character in their life. There are mental health issues going on. There are increases. There are substance abuse in adults because of all the things that are going on with the kids being home. And there's compromised learning. Let me tell you, having been through remote learning with kids, it is not as good as the kids being in school. So it is important. And the schools look at your scorecard. So you can't say, well, we're not responsible for what the schools do. You're not responsible, but they look at your scorecard. You're accountable. Okay? Let me say that. The scorecard also affects your businesses. I mean, face it, it drives your mitigation strategies. From a recruitment perspective, I went on and did a Google search of Shawnee County and COVID, and what pops up is uncontrolled. I was responsible for recruiting cardiologists and cardiac surgeons to this community, and these are smart people. They Google things, and I'm sure other businesses do, and when they start Googling Shawnee County and they see uncontrolled, COVID's out of control, that's going to affect their decision to come here or not. I believe, correct me if I'm wrong, you decided to move back to open meetings because of your own scorecard, okay? And the fact of the matter is, at this scorecard, when you look, it drives fear in this community, okay? There's been so much fear about COVID across this nation. I haven't seen such widespread fear in the population since the Cuban Missile Crisis when I was a youngster. And those of you who are old enough to remember that, you know what I mean. At any rate, your scorecard is important. So let's look at your scorecard. Top level is your gas gauge, all right? That's a cute little thing, all right? That's where everybody looks. I know that at least 501. They just look at that. It's in the red, no school, or there's limitations. The schools are looking at this, all right? The gas gauge is great. Everybody looks there. But then your scorecard drills down, and since I can't do that on the screen, you go to the next section. You got your gas gauge, and then you've got all your indicators, and there's a lot of numbers on there. Then you go to the next gauge, the next page, and that's another level down. That's the justification, or how all the indicators are weighted. Then you go to the next page of what's on your website, how to use and interpret the technical notes, okay? And this is where I'm looking and I'm thinking, oh my goodness, this is finally where, from a data person's eyes, I'm going to figure out where they got this stuff from. And lo and behold, what do I see? I see one reference, the CDC, under item 5. This should explain the scorecard, I think. All right, so I click on that reference to find out where your scorecard came from. And have you ever looked into that? You have, okay. Well, I'm going to give you a copy of that too, so you have it to reference. Oh, I'm sorry. This is the one reference for your scorecard. And you can read through, I've read through this in detail. And lo and behold, you turn to page 2, table 1. This is the level of mitigation by level of community transmission. Your scorecard said this is the community transmission and severity scorecard, okay? So this is what your scorecard is based on, and it's very clear. There are 4 categories here, just like you have 4 categories, and the top one's your red, second one's your gold, third one's your yellow, last one's your green, okay? When you start reading the community characteristics, for example, the red says that red is large-scale, uncontrolled community transmission, including communal settings, examples, schools and workplaces. And it goes down from there, all right? You don't see anything on the CDC recommendations for determining the severity of the COVID crisis, anything on there regarding hospital occupancy rate, hospital preparedness, public health system capacity. That's on table 2, which is not supposed to be used to determine the severity of your disease. It's supposed to be used as a reference, as something to consider when you're figuring out your mitigation strategy. Okay, what I'm getting at is the last 2 items on your scorecard shouldn't even be on there. And they're putting weight into your scorecard. That's not me, that's what the CDC is saying here, based on the one source that you have, okay? Now, the top 4 could possibly be considered part of your scorecard. And I'll go into that in just a second. Now, one thing you'll notice if you look through this entire paper, there is not one number on here. There is no documentation for where did we get this score that 14 is high and that 17 to 24 is uncontrolled. Where did we get from page 2 on the scorecard the weights that should be assigned to these? There's nowhere that is documented that it came from. Where did all the definitions of the case numbers, everything else, where did they come from? They came from nowhere. Your entire scorecard, virtually every number on here, is not based on science. It's based on opinion. Okay? That's a fact. Now, in defense of whoever created the scorecard, if you turn to the CDC reference, if you turn to the scorecard, the last section, number 3, all thresholds between categories were set based on best available evidence from national and state organizations, when available, as well as direct experience in Shawnee County. In other words, there's no documented reference for that either. It's all anecdotal evidence. Your scorecard is based on opinion and anecdotal evidence. This is getting to why other counties, I appreciate Commissioner Rippon saying something about other counties only have a couple of things on there. That's because there is no documentation of what should be on here. Now, the only thing the CDC recommends are these general categories, general descriptions, which is probably where your scorecard ought to be. So now if you start looking at your scorecard, keep in mind the CDC indicators. They say large scale, uncontrolled transmission, and including communal settings. That's it. That's what they talk about in general, subjective, descriptive terms, because I don't think there's enough data yet to know what should be on a scorecard. So, if you look at indicator number 1 on your scorecard, weekly incidents, number of cases. Okay, I can accept that at face value, ignoring anything about cycle thresholds or where did the flu go. Let's just accept that those case numbers are valid cases for COVID, okay? That makes sense. That makes sense with what the CDC says about keeping track of controlled versus uncontrolled. But where did the number 175 come from? Again, there's no documentation, there's no science for that. And it does, interesting, it does represent 1/10 of 1% of the population of Shawnee County. That means that in 10 weeks, 1% of the population would be infected. That means in 52 weeks, one entire calendar year, 5.2% of the population would be infected. Does that fit the CDC subjective description of widespread? 5% in 1 year? I don't know. Maybe it does, maybe it doesn't. But it's certainly not a number that I found in the literature or in anything that you described in here. Number 2 on your scorecard, trended incidents, increasing, decreasing. That seems to fit the controlled versus the uncontrolled aspect of what the CDC says. It seems reasonable to be on there. Number 3, percent of positive tests is on your scorecard. Well, that is a jello indicator. The numerator is, I assume, number of positive tests. Okay, that's pretty clear. Based on number of tests performed. Well, my experience in working with doctors, and I've got 41 years of working with doctors, they're very smart. Over time, they know what sick looks like. And they learn over time what a particular disease entity presents like and what it looks like. So over time, doctors are going to order less COVID tests because they're getting smarter about COVID. And if you have the same number of positive tests and doctors are ordering less, your percent of positive tests go down, which makes your scorecard look worse when the doctors are really getting better at it. Or if someone opens their door and decides to provide COVID testing cheap, all these tests get done, same number of positive tests, and all of a sudden your percent of positive tests goes way down. This is not a controlled variable. This is a ridiculous variable. I don't even know why it's on your scorecard. Anybody who knows anything about data should be able to figure that out. So indicator 3 shouldn't be on there. You could index it to the total population of Shawnee County, but then that's just double dipping into the number of cases, same thing as number of cases. So, and then also indicator 1, by the way, has that little asterisk by it. It gets double weighted. That's made up. There's no science for that. How can you rely on that? Sorry, I forgot to say that earlier. Number 4, percentage of cases with no known source of infection. I don't know a lot about that. The only place I see that referenced in the CDC in the support documentation is in the green category. They say that case reviews are going on. Item number 5, hospital occupancy, again, is not by the CDC recommendations on the scorecard. but you have it on yours, okay? And I think there's a reason why the CDC doesn't have that on their recommendation for determining the level of severity and transmission. That's because hospital census, hospital occupancy is affected by so many other things. You've got on your scorecard that hospital occupancy of 85 to 90% puts you in high risk. Well, I've lived through 41 years of the flu season, and it was not unusual at all for the hospital to be 85, 90, 95% occupied, having nothing to do with COVID. CDC doesn't have it on there, I imagine, because hospital occupancy can be affected by so many other variables, i.e., it shouldn't be on your scorecard. I can't answer to public health. I don't know anything about their capacity, but I do know that the CDC doesn't have that on what they recommend to assess the severity of your COVID crisis. So I guess kind of then the last thing I wanted to mention, the deaths. Someone talked about, you all were talking about recovery rates. This is a huge contributor to fear in this community. All you do is report deaths. I mean, on a national databases, you always report incidents of death. That's standardized, and it gives it context. So, I looked at the data. For an entire year now, we've had about 15 to 16,000 cases. That's 8 to 9%. Excuse me, let me take that back. Deaths. We've had 263 deaths in the entire year. That sounds bad when you look at it. Why don't we publish that represents 0.15%, less than 1%? I think that would make people feel a little better instead of just raw numbers. If you're infected, it represents 1.7% of the population. So if you get COVID, you've got greater than 98% chance of surviving. That puts the deaths into context and helps to mitigate the fear instead of just throwing raw numbers out there. Anyway, your scorecard looks good. It's very impressive. It's got the standard, what I call stoplight, red light, green light, yellow light. That's very common. And because it's got all these numbers and all the pretty colors, it's powerful, and people look at it and are influenced by it. And if it looks bad, it scares them. But it is not an accurate representation of the severity. I believe it's based on arbitrary algorithms. My point, there's no reference for any of the numbers in there. They're based on opinion. So I'm hoping that our new health officer will take into account what I've said and really relook at the scorecard, because I don't think it's an accurate representation in any way of what's going on in Shawnee County. If you just read the CDC guidelines, what they describe the community as, I think we're in their level 3 or 4, way down. And one of the main things that they mention in there, sorry I'm bouncing around a little, is the communal transmission, widespread communal transmission, and they talk about schools and businesses. We don't even address that on the scorecard. We don't even address that. One of the things that the CDC recommends that it should be if it's severe, it should be occurring in these large communal groups. It's not there. So I'm looking at this through experienced eyes, and it's a very suspect scorecard. And I just ask you to consider that. So I don't know if I take see if you have any questions for me or want to tear me apart or what you want to do.
I just might add that, I think you've given us something to consider. I know that our scorecard is under constant review. Your comments are taken and with consideration. The persons involved with Dr. Locke, Dusty Nichols, Craig Barnes, those individuals that contribute to the creation and maintenance of the scorecard of here, they've heard your comments. I'm sure that they're going to be taking those comments into consideration in review of the scorecard. So thank you for sharing them today.
Okay, thank you.
Thank you very much.
Are there any other comments today or public?
Good morning, Commissioners. Craig Barnes, Health Department. The one thing that I wanted to mention today in addition was the Community Health Needs Assessment is ongoing in our community. The surveys are available for the community members to take part in. This is the survey that we do on a 3-year cycle that helps us create the objectives in partnership with our Community Health Coalition, Heartland Healthy Neighborhoods, and many of our other key stakeholders in developing the priorities and the objectives for our community health improvement plan. So I just want to take the moment to encourage individuals and the public to take the 5 minutes and take the survey. It will help us get a better understanding of what the needs are around health here in our community and help inform our decision-making processes so that we can have actionable and good interventions here in our community to improve the health and well-being of our citizens. So,
Thank you.
thank you.
Morning, Commissioners. Dusty Nichols again. One other gap that we forgot to mention. If you are submitting a plan for anything that goes over the mass gathering limitations or you're requesting that, submit that plan to the COVID-19 info at snco.us. It's up on the screen. Preferred Microsoft Word document so we can work with you, whoever submitted the plan. These are the basic items that we're going to need in that document for your plan. If you are specific to any kind of event, there's on the CDC, there's plenty of guidelines on mitigation efforts and mitigation criteria, guidelines, all that stuff, tips, hints to put your event together. So if you are submitting a plan that will go over the, potentially go over the 300 max, this is where you would submit it. Please don't send it to just any individual on the COVID team because there's a good chance it'll get lost. We get a lot of emails. They'll be looked at in the order that they're received. They'll be approved by Dr. Locke after they're reviewed by emergency planners and safety planners. And we have a good system set up that we can get through these pretty quickly if they're submitted correctly. So that's all I got. Thank you.
Thank you.
Good morning. Aaron, you are our county commissioner for my district.
Your name, please.
My name is Kathy Hopak. I just wanted to speak on a personal level about the fear of the scorecard, and that is, I see many people of all different ages, as I'm sure everyone else does, but you run into people. I've talked with people on the phone, and they are scared. They're absolutely petrified. And I don't think that they're responding to you that way. I don't know that they're telling you that, but they are absolutely scared that if they go and do anything, they're going to die. Our grandchildren, when they come to our home, they've been around us through this whole thing because they are forced to wear a mask all the time in school, and children don't, according to the CDC, should be in school. Children, they've had their mask on. I have to ask them to take their mask off when they come to my house. This is becoming, I think, out of control in people's minds. I don't think they feel like they have control because they're not getting the right data at all. And I just, as a matter of fact, one time when Joe and I were in Menards and I hadn't put my mask on quick enough, I had another guy come up and tell me to put my damn mask on. You have people petrified out there that are upset, they don't know what's going on. And that's just from my own personal experience, which maybe doesn't hold a lot of weight, but I'm around quite a few people. We are involved with our community, and they're scared. They're absolutely petrified, and I think that's not good. I don't think people can take control of their health care as well when they're scared like that. And so I really do think that you need to get better education out there and better information out to the public. Thank you.
Thank you. Any other comments? Commissioner Rippon?
Just trying to stay warm.
All right.
I just want to say, if you have pets, bring them in at night, especially, it's cold out there, even in daytime. Make arrangements to get them inside.
Great. Commissioner Mays?
Nothing from me.
You just might kind of echo that as be weather aware. We're supposed to have very brutal winter weather this next weekend with wind chills and very, very low. Please be aware of your pets. Make precautions if you're out traveling. And then also, as we run space heaters and other devices, make sure you're being safe with those in our community. So that's all I have. Our next item.
Item 6, executive session.
There is a need for an executive session not to exceed 15 minutes, and it would be on personnel matters of non-elected personnel, and then also for consultation with the attorney for the body of agency, which would be deemed privileged in the attorney-client relationship on the same item, and that, again, is for not more than 15 minutes. Motion made by Commissioner Cook. Is there a second?
Second.
Show second by Commissioner Mays. All in favor, say aye. All opposed? Show that we are passed 3-0 in executive session for 15 minutes. If you can give us, Cindy, 5 minutes to get down the hall, we'll start at 10:45.
Okay.
To return at 11.
Okay.
We are back in session. No action was taken. We are adjourned.
I'll have to get your